All right, friends, I'm going to call this a super review on gastrointestinal system. And friends, it's going to be a super review. I'm going to hit all hot spots I can think of every exam for health assessment, MedSurge 1, MedSurge 2, Exit HESI, NCLEX, all the way up. I am not going to give you a detailed synopsis of this body system. I will do that later. What I will do, considering we have exams tomorrow for some people and a bunch of students that need a lot of help on the same subject, is I am going to go through the entire gambit. Am I going to give you verbatim questions? No, that's cheating. Hi, guys. You've met me, right? You've seen my moral compass. You know I'm like a Kmart radio. I don't play because it ain't happening. But what I will do is I will be a habitual line stepper, which is what this entire institution allows me to do because they know that I am pure of heart and pure of spirit, and I am noble in my intentions, and my intentions create actions, and my actions create success. So here we go. I'm going to give you the super crazy review of gastrointestinal for all the way up, tippity top, biggity bottom, and in between, for every single test that I have ever seen in my entire life, as close as I can get to it legally without getting in trouble, and making sure that everyone understands, and making sure that academia is happy with performance and my students are happy with continuing about life and being proud of themselves so that we can all be blessed and succeed. The end. All right, 1, 2, 3, go, friends. Let's do it. Dear Lord, give me the strength. All right, gastritis. This is going to be a minute. So it's an inflammation of the stomach lining, basically. Duh, itis, right? Inflammation. As in gastric. All right, cool. So weakness or injury to the mucus line barrier that protects the stomach wall. What it does is it allows the digestive juices to damage and inflame the stomach lining. So that's what's happening. So a number of diseases and conditions are correlated with this, specifically things like Crohn's disease. What causes it? All right, like bacterial infections. So what does that mean? H. pylori. It's among the most common worldwide human infections, right? So H. pylori is a big thing. Regular pain relievers, specifically ibuprofen, is what I normally see on exams. Although sometimes I see things like what they call a naproxen sodium, which is like the derivative of Aleve, or your traditional like Advil, Motrin, ibuprofen, things like that. It can cause both. Using the pain relievers, it can cause both acute and chronic gastritis, depending on how long you've used it. Regular use of this has a big problem with having long-term conditions related to your stomach and even certain types of stomach cancers. Older age is a problem, right? Because you are more likely to have H. pylori infections or autoimmune disorders than younger people are. All right, so like excessive alcohol use is another one. It erodes your stomach lining. I think that's pretty self-expression or expressive. Oh boy, it's gonna be a big day. All right, it's gonna be fine. All right, stress. So severe stress due to major surgeries, burns, injuries, things of that nature. Cancer treatments will do it as well. HIV, Crohn's, AIDS, celiac, sarcoidosis, parasitic infections. I think you guys get the idea of what I'm trying to talk about here. Things of that nature is also within this confine. So what does that mean for you guys? All right, so when I see things like gastritis, there are only a couple of things that you're going to get. So it's going to be related to gastritis, knowing that it is related to an H. pylori infection, or gastritis and knowing that it's a problem with NSAID overuse. So let me attract my brain for just a second, because I'm sorry, this is a big day, and the stress of making sure that I get what you guys need is just, let me just calm my nerves. I can do this. We all can do this. Guys, see, I get nervous too. I'm going to keep this on. I'm not going to edit it because I want you to feel what I feel right now. Like, channel into this, guys. You can do it. This is what I'm teaching you to do. I still get stressed. after doing this for so many years. 13 years I've been on this block. 13 years. And I'm still just as scared as you are, and it's not even my test. Remember, it's okay. We are all in this together, truly. Okay, let me think. All right, I feel better now that I just got through saying that. I think you needed to hear that. I think I was feeling the tension of everybody texting my phone right now because I have 28 messages. 28 messages. Okay. Yeah, smoking. Smoking, stress ulcers are a thing with this, heavy alcohol consumption, vitamin B12 deficiency, which is why we have the H. pylori problem because of the lack of intrinsic factor. What do we do to fix this? Tried antibiotics, right? Think the prazols, right? So, amoxicillin's another one, clarithromycin's another one. Flagel's another one, so metronidazole. All right, so that being said, those all... Ooh, I have an anagram, don't I? Yeah, kind of. Yeah, I can do this. All right, cool. So let's do... Don't laugh at me. Let's do CLAME, C-L-A-M-E. Okay, C-L-A-M-E. Okay. So that is clarithromycin, lansoprazole, amoxicillin, M, metronidazole or Flagyl, E, E-S-O-M-E, P-R-A-Z-O-L, esomeprazole. There you go. I think that might be right. I'm pretty sure that's right. All right, cool. So what do I need to know about this as far as questions are concerned that I've seen? It's usually the same one. It usually is related to a patient who is coming in with like intractable vomiting, and it's like bloody. And you're going to need to know that you need to ask this patient if they have long-term NSAID use, right? Or patient education on gastritis management related to smoking is also a classic one. So letting them know that they can't smoke, and they have to watch alcohol consumption, obviously, because this is going to lead to other issues. Beyond that, for gastritis, I really don't have a whole lot for you. I don't get too excited about this. Again, alcohol management, knowing that it's correlated with the B12 deficiency, knowing that that is also correlated with H. pylori, knowing that we're damaging the mucosa, and all of the things that are on the slide. I mean, literally, that's it for this. The foods. Yeah. I forgot about that. So this is a process and a disease that is related to something corroding, eroding, or exploding is the way I put it, right? So either something is being worn away, either something is creating it through toxicity, or it's quote unquote exploding, which means it's spreading about because those inflammatory mediators are sending signals to keep it hot, right? So that it just charges up and just spreads about. So that is this disorder. So here's the weird thing. Cloves and paprika, not even playing. I've seen this question on the NCLEX before. I think I had this question on the NCLEX, and I think it was paprika related to this. So I don't know if that's a thing. It's been 10 years. I'm old. It's cool. I can make it handle. So I see paprika. I don't know why. I see paprika, so give it a try. How about that? Now let's go to the next disease process, and hopefully I will not be so scatterbrained, and I will get into some rhythm here because I'm starting to feel the flow. We got this, guys. We got this. Oh boy. I tell you what, this day it stinks. Kind of like C. diff. So that's a joke for two reasons, because A, you actually can't smell C. diff, and B, because I was making a double entendre about it stinking the day. So I figured you already knew that, but just in case you didn't, there it is. So C. diff. So it's a spore, and it's a spore that, it travels very easily. And that's the reason why we put these guys in contact isolation, because it's such a big deal. So C. diff travels in the gut, in the intestines, and they poop. And when I say they poop, I mean they poop water. And when I say they poop water, I mean really they poop water. So problems we're going to have with these guys. Severe dehydration. All right, cool. If they're severely dehydrated, what problem can we run the risk of? Well, dehydration, I just said it. Yeah, sure, no. But when we're looking at acid blood-based situations and we're looking at arterial blood gases, you might want to know where this falls in line between the metabolic or respiratory process. Well, we know it's not respiratory because respiratory is solely for the lungs, and this is a process of us losing things, which means it's metabolic, okay? Then that gives us an option of alkalosis or acidosis. Now, what happens is when you are effectively pooping out constantly, you're constantly losing things, and that creates a loss or imbalance. So if you're losing the items that are creating the basic or the basis or the base of your internal structure, then all that is left is acidity. So this is a metabolic alkalosis type of situation. All that we have is a yield, and because we're losing so much of the things that we need, the nutrients that we thrive and have to survive, this is the flux that we're in. So problems related to C. diff include metabolic alkalosis, okay? All right, so now let's talk about the other things. So contact ISO, that's always going to be on every daggone test related to C. diff. You have to know what contact ISO means. It means you have to constantly wash your hands, okay? Because washing your hands is the only thing that's going to kill it. You have to have a gown and gloves. I feel like that's self-explanatory. These people are pooping all the time. Boop, 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 boop. It's everywhere and it's liquid. Hey, by the way, if you sit this person to the side and you're going to be changing them effectively because they have a brief on, I would highly encourage you to unsnap the brief first, put a Chuck's pad under, and make sure whatever you do, don't jostle them too much. Those of you who knows what that means, you were laughing right now. Everybody else who's super confused, this is why I constantly tell you the things I tell you and lecture you like a mom, because I know what that means, and so does everybody else laughing, but you don't, and that's why we're laughing harder. Listen to the words I say. I'm actually kind of smart. I'm smarter than I look. How about that? Just a little bit. So, other things related to C. diff that I have always seen. First, we have to confirm C. diff, which means after we have 3 bouts of diarrhea, if this is a brand new occurrence, after that shot through, not being funny, haha, you have to get a sample of this. And that sample has to be supported by the lab. So the lab has got to go, okay, that specimen is all clear before you can give them interventional medicine like Imodium. All right. You're not going to give them Imodium before. A lot of times that becomes a question too, right? A, how do we collect the sample? B, what does the sample need to look like? It's got to be completely liquid, by the way, or they'll give it back to you and say, no, do it again. And we have to recognize how many liquid stools. The hospital standard is if we have 3 occurrences of consistent liquid stools back to back to back, we're testing. Some hospitals I've seen that it's within a 24-hour period. Some doctors are not very smart at all, and they will have a patient who was on a brand new feeding tube and will then give them a C. diff specimen, and I just try not to die on the inside. There's that. Let's see what else I have. Patients, they have to have a private room, period. As soon as we have a C. diff patient, you contain and quarantine, period. Okay? That's going to be a thing. What else can I think of? Just standard precautions, hand washing. Whenever you're going to be in contact with anything, making sure that that's it. That's all I got. I'm sure that there's other things, but those are the hot spots that I can think of that show up on any big exam. I mean, I'm going to do an obvious super review for all of this. It's a little more detailed and tiered down. But when we're talking about exam quick review study guides, and that's exactly what this is an exam quick review study guide versus a full-on lecture in detail. This is what we're going to get because it's quick review. How about that? So let's jump over to the next topic. Read these pieces and parts that I have in front of you. These are the pieces that I've looked at that I have seen most often. So yeah, I think we're good to go after this. All right, GERD. All the things on the board that you see. read it, know it. These are all the things that I constantly see. All right. I have taken the time to go through all of these slides to find these. For the love of Pete, read it. Commit it to memory. If you don't know what it means, look it up, Google it. When I say Google it, make sure that it's a reputable area. I would prefer you use the book. I know you don't have time. I get it. We're all in a crunch. So here it is. In addition to these things, I see more often than not the following to the left. You need a special diet. What is that diet? Don't eat a bunch of crap. Specifically, don't smoke, don't eat don't drink caffeine, don't eat chocolate, don't eat any spicy foods with pasta sauce, tomatoes, bad idea. Anything in between, you are more than welcome to look it up. Also, common miscommunication. Milk actually makes the situation worse. Okay, so don't do that either. Snacks 3 hours prior. Make sure that it's a light snack. Make sure that it's 3 hours prior. You don't eat anything right before bed. That's a dumb idea. You're going to lay down flat and everything's going to go back up. That's the whole point of this whole disease process. I feel like I'm going crazy. Gastrointestinal esophageal reflux disease, as in it refluxes back from your gastrointestinal system to your esophagus, aka it's going up Cartman style. Remember that episode? That was hilarious. Okay, cool. So there's that. Know these pieces and parts. Know what they mean. Know that you need a PPI. What's a PPI? It's a proton pump inhibitor. What's a proton pump inhibitor do? All right, versus an H2 receptor antagonist. What kind of medications are those, by the way? What kind of medications are those prokinetics? All right, these are the things that I need for you to know specific for GERD. Now, let me kick my brain into gear for a second and see if there's anything else that I'm missing related to GERD. Because the quicker I can think through this, sorry, I'm literally scanning through 9,000 things in my brain. Diet, positioning is prone. Don't go flipping them around. Keep it minimal. Reduce smoking, reduce alcohol, avoid fatty foods, fried, spicy, citrus, caffeine, chocolate sucks. Elevate the head of the bed with blocks. Why? Because it's the head of the bed, by the way, only. Why? Because it lays you at an incline and, well, you're sitting up and your stomach is not going in a bad direction. This is a matter of things flipping and flopping over, right? Because of positions and such. 2 to 3 hours before. Making sure that you don't lie flat after you eat. I've seen 45 minutes. I've seen an hour. More commonly, I've seen an hour, if I'm honest. What else would I say? Guys, that's it. That's all I've got. That's literally all I've got. Make sure it's the left side versus the right side. Sometimes they specify just because they want to be anal retentive about it. It's the left side, and why? It's because it basically flattens out the stomach and it puts it at such an incline that it can't reflux. How about that? Just keep it that way. So all these things, yep, that's all I got. And then let's go to the next one. I think we're going to do Hep A next. All right, so Hep A. All right, Hep A and Hep C are going to be your boys. Don't worry so much about Hep B if you had to commit anything in the world to memory, because I rarely see Hep B. I always see Hep A and Hep C. Hep A you're always going to see related to fecal oral, poor sanitation, contamination of foods. What happens? They got flu-like symptoms. They're disgusting. They're peeing, they're pooping, their whole body's aching. They've got nausea, vomiting. They don't want to eat. Sometimes they get uber constipated, and then they start having nausea and vomiting for days. And sometimes they have massive amounts of diarrhea. It varies, right? They got this aches just kind of everywhere. Sometimes they have this crazy mid-right abdominal pain and tenderness, and that's because we're not eating, we're vomiting constantly, we are stretching our system, we're stretching all of our internal structures from heaving. So that is where the centralized pain is located, which makes sense, right? When you're dealing with Hep A, we have concerns for things like full-on condition that goes potential to be chronic or progressive. So we have to do liver studies to see how bad this condition is, to see what we need to do with it. So we're going to do things like ASTs, like ALTs, like bilirubin makes sense because they're going to be a little bit on the jaundice side, right? Viral testing, right? Things of that nature. What else? What else? Oh, incubation period on hepatitis A. It's 28 days. So here's the kicker. Sometimes you will go eat and you will then think that you have food poisoning 24 hours later. That is not food poisoning. Totally different. If you have malaise and flu-like symptoms and things of that nature, this has been going on for weeks. Weeks, friend, weeks. So that would be a direct thing as well, related to making sure that you understand that this would be something that would be data supportive of Hep A versus something that is a more acute 24 to 48 hour period type of condition. All right. Because that's going to dictate how we take care of these things. So, making sure that shellfish is cooked is important. Making sure, because this is highly contagious, that we keep these people away from other people while they're going through the get better period. What else can I think of? That's literally it. Oh, hand washing. Hand washing is everything because this is a fecal oral problem, right? So that's the issue. Yeah, keep hydrated. You're going to have these symptoms. My concerns, dehydration. Duh. My concerns, hypo everything, right? My concerns related to that specifically is we need to focus on potential IV hydration for this patient. We're going to need normal saline because they're losing kind of everything. We also need to make sure their electrolytes are in charge because they're probably not. And I would expect this person to be in a state of metabolic alkalosis versus metabolic acidosis, because metabolic alkalosis is the pee and the poop and the everything is coming out of me syndrome. So keep that in mind for ABGs as well. I think that's it. Next slide. There's not a whole lot to tell you about Hep B that's super exciting. I'm not going to lie to you. When we get into Hep A, some people have a light varying degree of jaundice. Potentially, it is rare. However, in B, that's when we really start to see the yellowing of the eyes being a thing. So this is when we first get that. So if that is dark urine, abdominal pain, yellowing of the eyes, at that point I'm going to go, okay, that's Hep B for sure. This can cause scarring. This can cause progression of disease process. Okay. With Hep B, I don't get a whole heck of a lot, if I'm being honest, because again, it kind of looks like C. And I'm not going to sit here and confuse you between B and C. So I'm going to give you the facts. Here's the information. I don't know if you're going to get something on B, but man, I rarely see anything on B. I'm struggling so hard to see a question on B in my brain that I feel like it's not even worth talking about it anymore. So I'm going to get this one out, but read this information just in case I'm stupid and wrong. Because, hey, remember, I am part human. That is a thing. I promise you, right? But right now I'm the machine. So let's get to the next slide. Hep C. All right, there's no vaccine. First off, none. So it could be transmitted from parent to child. Fecal oral route is possible. Sexual transmission, duh. Needle sharing, duh. All the other things, duh. It usually is found out super late in the game. It becomes what they call active, right? So this is when you get to C's is where it just goes and it goes and then it hits it hot, right? So what do we do for the simple things? What do we do for management? There is a vaccine available. However, it comes with a lot of attachments. And as much as I want to get into you have to be this old, you have to be this committed to the program of your sobriety, you have to do this, the insurance has to There are like 15 different things you have to do, so they make it nearly impossible. But there is a cure. There really, really is. I've known somebody that's had it. They were a personal friend of mine. They're actually, kind of a surrogate uncle of my father, and he is quite phenomenal. And I will tell you about that experience and the things that he goes through when I get into that. But I'm not doing it right now. We're doing super review. So I am focused and I am a machine, and that's that. And I needed that affirmation for myself. Sorry, let me digress. Diagnosis. I was going back to the vaccine. So it is an interferon alpha. This medicine. It is a long-term thing. It takes, I think it's a 6-month medication, if I'm not mistaken. It is an antiviral. It is a Ribavirin. Ribavir, Ribavirin, right? Ribavirin, yeah, that's what that looks like. They call it Rebitrol or Virzal. Virzal, that sounds fine. With these guys, you need to promote good nutrition. These guys' lab values suck. And I'm about to go over lab values in the second half of this. I don't have time to do it right this second because that's going to be the longer one. And I want to do the shorter one so you guys can be going through it, taking notes, doing what you need to do. And then I can be working on the back half of this, okay? And then we can move on to a new body system. And I'm going to do it all day long. And I have no idea how long I'm going to get done or how long I'm going to take or what I'm going to get done. But I'm just going to do it. And I'm just going to keep doing it body system by body system that I think is going to be hitting the hardest. And then we're just going to go from there and hope that it's enough. And I'm so sorry. So yeah, there's that. Let's go to the next slide. And I think the next one is E. coli. And then I'm going to shut it off and download it, export it, send it to you, and then start section 2. All right, so E. coli, also known as Escherichia coli, comes from infected cows. It causes hemorrhagic fever if it gets out of hand. It can survive for up to 3 months on any stainless steel surface. That's why it's such a big deal. It can survive in like water for like 5 months. It's a big deal. It's a hemotoxin to your colon, which is why we get sick off of it. And it causes the lining of the colon to bleed. So what does that mean if the lining of the colon starts to bleed, right? Well, that means that we're going to have bloody stools. So if we have bloody stools, we need to get a sample of that, period. Be careful giving this person Imodium. E. coli comes from infected cows, right? So if you have food poisoning and you give someone Imodium because they have E. coli and have diarrhea, you have effectively contained that toxin within their body. The whole purpose of diarrhea from the person is it is trying to expel that from the body to get it out, not self-contain it so that it can then become sepsis. So you gotta be really, really careful for that, okay? So when we're talking about transmission, we're talking about fecal oral. The problem with E. coli for transmission is usually 3 plus or minus 3 days plus 10 days. So 13 days is when you're usually having this problem. It doesn't take much to cause any issue. You need antibiotics and hydration. Sometimes you need hospitalization. Complications with E. coli include kidney failure. Why? Well, because it's like the number one thing that causes, UTIs. There's that. How long does it take for E. coli to cause true kidney infection? God, a decade or more of chronic kidney or chronic UTIs. But it happens often in the elderly. Like half of the people who have E. coli are elderly, FYI. So what are some things that they tell you to watch out for? Well, a lot, like seafood, because this really, really has a high level of contaminant as well. So in addition to these regarding E. coli, I don't get a whole heck of a lot of, if I'm honest. So just know those pieces and parts and know all the things on the slides, and we should be good. So this is the end of part 1. I'm going to do part 2. Part 2 is going to be long. We have to talk about a lot of things. We have to talk about ostomies and ostomy care. Geez, like I can go on for days about that, but I'm not going to. I'm going to look really quick. I'm going to compact it and compress it, and I'm going to get back with you as soon as I can. I'm going to quickly send a WhatsApp and get back on it. All right, guys? All right, love you. I'm proud of you, and I'm just as nervous as you are. We got this, though. We're going to do this. We got this. We got this. We got this. We got this. All right. Love you. Bye.